One of the main principles of the effective and contemporary stroke care is to obtain knowledge and to practice skills by the stroke team. Thanks to fruitful cooperation with the Angels Initiative, stroke simulation training course was created in Poltava Regional Hospital. The main goal of the course is to shorten the time for stroke treatment decisions made at pre-hospital and hospital stages. Simulation training is held during 1.5 days and includes the following: a review of the latest guidelines and new clinical trials on stroke care, training on the basics of the neuroimaging and exchange of experience in endovascular treatment, training on the main stroke scales,
Мне трудно шевелить левой рукой и ногой.
virtual simulations using Body Interact,
Назначено исследование.
carrying out the simulations themselves with the further analysis of the detected errors, carrying out simulations themselves with the following debriefing. Simulations are carried out not only for the teams from current stroke units, but also for the staff of those centers that want to treat patients with strokes in the nearby future. These teams are always from the same department from the same hospital. This team consists of EMS staff, nurses, neurologists, intensive care physicians, and neurosurgeons. During the simulation, everyone has a possibility to try it himself as a stroke physician, nurse, EMS staff, and patient. Thanks to the team training, understanding is improved between those physicians and nurses who will continue to treat patients at the same stroke department. With the help of the Angels Initiative, checklists for EMS, stroke physician, and nurse were developed in Ukraine. Also during the simulation training, the Angels Stroke Kit is proactively used. It is a bag that contains the most important drugs and devices for the stroke treatment directly in the tomograph room. Thanks to the organizers of the center, the nurse has a possibility to mix the powder and the solvent for thrombolysis that is almost the same as the real drug. Only during the simulation training there is a possibility to ask all important questions and to practice different possible scenarios. In the simulation center created in Poltava Regional Hospital, there is a possibility to improve the knowledge and practical skills for stroke teams from all over the Ukraine. Brain is time. A patient's life after stroke depends on all of us.